Every physician has a list. Update the website, call the referral source, review the contract, fix the billing problem, hire help, create content, negotiate the medical director agreement, learn business, start the practice. And somewhere between, I need to do this and I'll get to it later, another month disappears. Here is the painful truth. Most physiatrists are not failing because they lack intelligence, compassion, or clinical skill. They are failing to build profitable practices because everything feels important, so nothing gets done first. That is the trap. And in today's healthcare market, that trap is expensive. Demand for PM&R is rising. Patients need functional restoration. Hospitals need rehab leadership. Aging populations need physicians who understand mobility, independence, chronic pain, neurologic recovery, and quality of life. Yet, many physiatrists are buried under increasing workloads, declining reimbursement, administrative pressure, and business decisions they were never trained to make. Medical school taught you how to diagnose foot drop. It did not teach you how to stop your practice from bleeding cash. So you keep waiting until you have more time, understand business better, or feel ready. Meanwhile, less qualified people are making business decisions around your clinical value. They own the systems, they control the contracts, they capture the upside, you get the workload, they get the wealth. That should bother you. The concept from the framework is simple but powerful. When everything feels important, stop asking, what is the most important task? Instead, ask, if I could only do one thing today, which one would I most regret leaving undone tomorrow? This is the regret test. And for physiatrists building a profitable practice, it may be the most healing, hopeful, and helping question you can ask because importance is abstract, regret is concrete. You may not know whether you should work on your website, negotiate your contract, build a referral system, create a cash pay offer, hire an assistant, or finally understand your revenue cycle. But you probably know which one is quietly punching you in the gut every morning. That ignored task has a cost. The contract you have not reviewed may be costing you six figures. The referral relationship you have not built may be costing you independence. The billing process you do not understand may be costing you margin. The content you have not created may be costing you authority. The practice you have not started may be costing you freedom. This is where FOMO becomes useful. Not the shallow kind where you worry everyone else is winning on LinkedIn. I mean the real fear of missing out on the professional life you were supposed to build. A life where you own your value. A life where your clinical expertise creates equity, not just exhaustion. A life where you are not begging for permission to practice medicine on your own terms. The suspense is this. Most physiatrists already know the next move. They just do not want to face it. It is usually the uncomfortable one. The conversation with the hospital CEO, the request for fair market compensation, the decision to leave a toxic arrangement, the investment in business coaching, the first offer, the first video, the first practice model, the first no to being underpaid for expert level work. The payoff is not that your entire business becomes easy. It will not. This is medicine, not a Disney movie. There are no singing birds doing your credentialing paperwork. The payoff is clarity. When you identify the one action you would regret leaving undone tomorrow, you stop drowning in fake productivity. You stop hiding behind emails, meetings, and research. You begin doing the work that actually moves your practice toward profitability. This is how independent physicians are built, not by doing everything, by doing the right hard thing first. For the physiatrist who feels behind, overwhelmed, and unsure where to start, here is your next step. Write down everything that feels important. Then circle the one task you would most regret avoiding for another day. Do that first, before email, before scrolling, before another quick meeting that somehow becomes a 47-minute hostage situation with a calendar invite, because your future practice is not waiting for you to feel ready. It is waiting for you to act. And if you are a physiatrist who wants to build a profitable practice, reclaim ownership of medicine, and stop letting other people define your value, the question is not whether you are capable, you are. The real question is, what will you regret not doing today?